What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doc, but I am a licensed and practicing doctor of physical therapy. And today we're going to be talking about what you need to know before your knee replacement surgery. I have 5 things that we're going to discuss and go over, and you really need to stick around for the very last thing that we're going to talk about. It's really, really important, and everyone should know about this before going into their knee replacement surgery. Well, to start off, you should know knee replacements are typically very successfully done. They're very successful surgeries. You see, or we see several, or not several, we see tons of patients that are post knee surgeries, and the vast majority of patients do well with them. They have successful outcomes with them. It is a very good and successful surgery to have done. That said, there are a few things that you should know about this before you go into it. So, number one is the surgeries are not expected to be pain free. Okay. And the knee replacements, they can be some of the most painful surgeries that you're going to go into and going to have. It's kind of a toss up as to whether or not a shoulder replacement or a knee replacement are the most painful surgeries. But it is expected and known that you're going to have pain with this type of a surgery. Therefore, your surgeon is going to give you pain medicines for you to use, and that will help you to uh, go through the exercise portion of this. It'll help you to deal with the pain that's going to be resolved, or not resolved, but that you're going to be experiencing with the exercises that you're doing. It's going to be painful just for the type of surgery that was done, and the fact that it's an orthopedic surgery, so they were cutting on bones and moving things around inside your knee, and so your knee is going to kind of be barking at you for a little bit. But that's what the pain medicine is for. So you're gonna want to take your pain medicine as your surgeon has prescribed it for you. That said, that leads us to number two. The second thing you'd really need to know before this knee replacement surgery is you're going to have all sorts of uh, random knee pains over the next several days, several weeks, months. You're going to feel kind of random pains here and there, especially early on. You're going to be feeling a lot of pain with it. That all being the case, you want to assume that the surgeon has done their job and they did it well. So, not just they did their job, but they actually did it well until such time that you have evidence to the contrary. The assumption is the surgeon did their job and they did a good job at it. Okay. So, I've had some patients when working with them, and some of the pain that they run into, and you'll get them, kind of thinking, well, is there a mistake that's happened, or is there a problem? Did the surgeon not do a good job, et cetera, et cetera. None of that is what you want to assume right off the bat. You want to assume the surgeon did their job and they did it well. Even if you think about it just from the standpoint of, say, the hospital, they have millions of dollars going into their surgical labs, all the people that are involved, all the machinery that's being used, all the equipment they have. They're not going to let someone operate on you that doesn't have a good grasp of what the surgery is going to be, and a good understanding and feel for how to get their patient successfully through it. That said, sometimes things do happen, and there can be mistakes, etc., being made, but that is not the norm. Those are outliers, and so you want to assume the surgeon did their job and they did it well until you have evidence to show to the contrary that that didn't happen for you. All right. A third thing that you really need to know about is you're going to want to do what your physical therapist is telling you to do. Um, the it is so important that you do the exercises. You're going to be given a few exercises at the hospital. When you come home, you'll be given a few more exercises in home health. And then when you go into outpatient, you'll be given several and many more exercises to do. This is all going to be a process and one that you can successfully get through if you will listen to your physical therapist and actually do the exercises that you're supposed to do. Here's the problem though, what we just talked about, it's going to hurt. So when you're doing the exercises, yeah, it's going to hurt to bend your knee. It's going to hurt to straighten your knee. You still are going to want to do that. And that's what our job is to show you how to do that, to kind of coach you through doing that so that you can successfully recover from this surgery. Your body is going to want to, because of the pain, not move. It's going to want to, you're going to want to just sit in a chair all day, or you're going to want to, stay in bed. That is the absolute worst thing you could do for yourself. So, number three, listen to your physical therapist and do what they are telling you to do. All right. Fourth thing, um, you're going to need family, friends to be around a lot within the first, say, 24, 48 hours to a little bit longer than that from when you come home. The reason for that is you're not going to be moving as well as you were before the surgery. So you're going to want to have someone to help you with all of those activities of daily living, helping you with food, helping you to dress, helping you to go to the bathroom, all that type of stuff. So do plan on that. Have someone that is there able to help you to get around the house, to make sure that everything is safely or being safely done, etc. So that is, if especially if you're coming home. I mean, if you're going to a skilled nursing facility, which some patients do, then obviously there will be people there that will be helping you. If you do not have home and of some sort of support from family or friends at home, then you're going to really want to consider that you might need to go to skilled nursing for the first like week to 2 weeks after your knee replacement. Okay, it's because you're just not going to be moving around, especially when the real pain starts to kick in. So that's going to lead me to the last thing that I wanted to convey to you before your knee replacement, and the reason, or what I was talking about at the very beginning, that this is really the most important thing you need to know, and that is right after the surgery and lasting for about 24 to 48 hours after the surgery is done, you probably are going to be feeling pretty good. A lot of times patients will be talking about how, oh yeah, I feel great. I'm able to go up and down stairs. Sometimes patients will feel like they can cook. And I've had actually a patient who was getting into cleaning and I think actually vacuumed the first day that they came home. Um, the reason for this and the reason that you're not feeling quite as much pain as what I said at the item number one that you would be feeling is because more often than not the surgeon has done either a nerve block with you or has put in some sort of analgesic into your knee itself so that you are not feeling the pain as it is normal or is going to present itself when that stuff wears off. Those types of pain relievers will wear off within about 24 to 48 hours after the surgery. That's when the real pain hits. So, anticipating that, you're going to want to be taking your pain medicine, and the highest one, whether that's oxycodone or hydrocodone, the highest pain med that your surgeon gave you, take that from the moment you discharge from the hospital and go home until you can't take that medicine anymore. Stay on that pain medicine, because when your when those analgesics wear off that the surgeon put in at the end of the surgery, um, you you want to have pain meds already in your system, and you're having that floating through your body to help you with that. If you wait until those analgesics in the knee wear off, then you're going to be chasing pain and it is not going to go real well. And you're going to have a lot of pain with it. So, highly recommend you take the highest pain medicine that the surgeon gave you, take it as the surgeon prescribed from the get go, even especially early on, whether you're feeling like you need to be taking that or not, just to get that floating into your system so that you can, when that nerve block starts wearing off, it will help you to better deal with and work through that pain so that then you can do the exercises, and that you can so that you can move a little bit better and move a little bit safer and make the whole recovery process successful for you. So I'm attaching to the end of this video a video on what you should expect with from physical therapy during your evaluation or during that first evaluation, from home health, also from skilled nursing facility. For those of you that go there, there's a good video on what you can expect on that very first physical therapy evaluation in skilled nursing. So those will be attached to the end of the video, so you'll want to check those out. Also, my next video is going to be what you need to know now after your knee replacement has been done. So be sure to check that out, and we'll be saying prayers for you all that things will go well with the recovery of your total knee replacement. All right, you have a good one.